Okay, good evening, everyone. I think because we have very limited time, just 3 hours from now until 11, to do practically most of the things that we did on Saturday. I think it's important that we start immediately. So when others join us, because it's a practical class, they can also try some of the activities that we are going to do now. I know the number is small, but I think it's important we start on time. So you're all welcome. I'm not going to repeat or even summarize what we did last time we met on Saturday because I want us to have all the time that we can have to do the hands-on for the follow-up of the theory classes that we took. So we are going to take the first part for about 30 minutes, which is developer research questions. So searchable questions or searchable clinical questions, whichever way you look at it or you call it, what it should be is a situation in which a clinician is seeing a patient and he encounters a situation that he needs to get a solution to. And we need to look at this situation from 6 perspectives. Either you are examining the patient and you are not sure of what assessment or what form of assessment or what outcome measure, if you like, to use to assess the patient's condition. So you don't know. So you can ask a question, what outcome measure can I use to assess this situation in this patient that has this? So that's examination. Or it could be that you have done the assessment, but you don't know how to interpret it to help you narrow down towards getting a diagnosis. So that is an evaluation situation. Or it could be that you have completed your assessments, you have done all the clinical reasoning thoughts that you need to do. You now want to select one condition out of many that are possible. So you're not sure what's the diagnosis. So you want to get a diagnosis. That's the problem. That's the situation. This is a diagnostic question. Or it could be that you have done the diagnosis, you want to start treatment, but you want to know how long will it take the patient to recover? That is a prognostic question. Then next, what intervention should you give to the patient? Remember, interventions are given based on the symptoms and signs that are present in the patient or based on the cause of the problem. So you are given an intervention. So what intervention is best to give for that patient? This is an intervention question. Or you know what intervention to give, but you are not sure whether it is an effective one. You want to confirm, is it really effective? So that also is an intervention question. And then the last one, which is the 6th situation, you have assessed, you have made a diagnosis, you have treated the patient, but you now want to assess the outcome of the treatment that you have given. And usually in rehabilitation, the outcome is related to the patient going back to get integrated into their community. So what is the outcome of the management on the lifestyle of the patient, on the functional life of the patient? That's the 6th situation, which is outcome. Now, in all these 6 situations, if you are asking a question, a searchable question that you are going to search to get the evidence to now come back to the patient and apply, each question must have 3 parts. Number 1, the patient characteristic must be there in the question. So what patient are we talking about? Remember, this is not an academic question. It's a clinical question. And therefore, it's not something that you just sit down in the lab or in your office and you ask the question. No. It's a question you ask while you are treating a patient, while you are managing a patient. You ask the question, and therefore you must have characteristic of the patient because you are treating a patient. What's the characteristic of that patient that you want to get the evidence to apply on? So what is the characteristic of the patient? Then number two, what is the outcome of interest? There must be something specific. Usually questions will say, is so outcome measure valid and reliable in assessment of patients with a condition? So assessment, what assessment? Are we looking at pain? Well, is VAS valid assessment of pain in a patient with osteoarthritis? So what is the outcome of patient characteristics? Patient with osteoarthritis. What is the outcome of interest? Pain. Assessment of pain. So if it's intervention, for example, is task-oriented training effective in the... So instead of saying management of patient with stroke, we'll say in improving motor function in patients with stroke. And therefore, in this case, the patient with stroke is the patient characteristic, while improvement in motor function is the outcome of interest. So this is something specific. Sometimes you may be looking at more than one outcome of interest. Therefore, you might say, is a particular exercise effective in improving pain and range of motion in a patient that has osteoarthritis? So meaning the outcome of interest is more than one. You have pain and range of motion. But in every question, you must have patient characteristics, you must have outcome of interest, and the question must indicate which of the 6 components of patient management that I've mentioned earlier it's referring to. As I've said, I'm not going to go back to the lectures. I know I've taken almost 5 minutes explaining this. I want us to go straight into the exercise. I want every single person, right now we have 30, 31, and I want each and every participant to ask a question from the component of assessment. So we are going to ask the question, post it on the chat forum, myself and Dr. Jibril Samani. Dr. Jibril Samani, are you with us?
Yes, sir.
Okay, wonderful. So the two of us are going to go through the questions as they are posted, and we'll be giving a feedback to participants. So we'll take 3 minutes to do that, or maximum of 5 minutes to do that, and then we'll go to the next component, which is evaluation. Then we'll look at each and every one of those components, and then in 30 minutes, whether we are done or not, we are going to stop. Then we'll now go to the next activity, which will be to develop such strategy. That should not take us more than 10 minutes. And then after that, we'll now select a particular database. We'll now do the search. Then when we do the search, we'll now take another time to digest the article that we have gotten from the search to now see what the article provides that's going to help us in solving the problem that we have asked in the patient. So at some point, we'll then do an exercise on the issues of practice-generated knowledge and patient preference and perspective. So, but we are going to take most of the time doing these practicals about raising the question, having such strategy from the question, searching a selected database, extracting the article, then reading the article to see what we can pick from the article to now go back to the patient and apply. So 3 minutes, raise a question on examination. So everyone should be working on a question on examination. So remember, ensure that the question has three parts. One, what is the characteristics of the patient? Two, what is the outcome of interest? Three, make sure the question indicates that it is an examination question. So please, I would like to encourage everyone to participate, because that's why we call it a practical class. If you participate and you are right, you get that confirmation or that assurance. If you are not right, you will be corrected. And the more you participate, the better you apply in the clinic in real life. So let's go. Okay, I think I've started seeing posts, and it took too long. There's no way that we can cover much if out of over 40 people that we have only two in about 3 minutes. It's going to take us a long time to cover a lot within the 3 hours that we have. But let's just start giving feedback to those that have posted. In adults with chronic low back pain, so during scenario, you can study the next ones, so that instead of taking me some time to study the question, when I finish, you can look at another one. In adults with chronic low back pain, so at least we have patient characteristics, which is adult chronic low back pain. Now, whenever we attach a description, it needs to be relevant. If what we are looking for, it doesn't matter whether it's an adult or a child, then there is no point adding a word that is going to confuse the whole search strategy. But if the results that we are looking for can only be relevant in adults, then it's very important to add the adult. But we'll see at the end of the question. At least I know we have patient characteristics, which at least we are looking at chronic low back pain patients that are adult. This is good. Now, how does spinal manipulation compare to mobilization in reducing pain and improving function? And another good thing is that we have an outcome of interest. We are looking at reducing pain and improving function. This is similar to what I mentioned earlier. It's not one outcome of interest. There are two things that we are looking at. And then what component of patient management is this about? This is about intervention. This is about intervention because we are looking at whether spinal manipulative therapy is effective as compared to mobilization in reducing the pain and improving the function. Now, remember, we said the question should be an examination question. And therefore, although this question is a very good one, it has all the three parts of a question that are expected in any question. This is not a question on examination. So possibly what you are going to do is to keep this in view so that when we get to the questions on intervention, they can then repost it and then we'll continue to work on that. But that's a very good one. Is pulmonary rehabilitation effective in reducing dyspnea in patients with COPD? Another very good question that has the three parts of a question. COPD is patients with COPD, that's the patient characteristics, and the outcome of interest is about reducing dyspnea. So this is the outcome of interest. What you want is to reduce dyspnea in patients with COPD. And what component of patient management are we dealing with here? Is pulmonary rehabilitation effective? The moment you mention the word effective, it shows that you are talking about intervention. And this also is similar to the first question. It is about intervention, not examination. But they are all good questions because they both have the three parts that we are expecting in a question: patient characteristics, outcome of interest, and the question has indicated what component of patient management we are dealing with. Another question says spasticity in incomplete lumbar spinal injury. So this question is not complete. At least I can see patient characteristics, which is incomplete lumbar spinal injury. Lumbar spinal injury that is incomplete. This is patient characteristics. Now the spasticity could be a patient characteristics, but it could be an outcome of interest. Maybe you want to assess spasticity in patients with incomplete lumbar spinal cord injury. That is a possibility. You have not said that. It could also be that you are trying to treat spasticity in patients that have incomplete lumbar spinal injury. If you are trying to assess it, it's going to be a question under examination. If you are trying to treat it, it's going to be a question under intervention. And therefore, this question is not complete. If you can complete it and repost, then we'll give you a feedback. Jibril, you can come in at any time. Do you want to take another question? I can't hear you. Is it only me, or is it generally everyone can hear you well?
Okay, let me check my audio. Hello.
Hello. Your voice is very faint.
Your voice is too low.
Aha, yes. So it's not just me. It's very faint. Ike, can you hear me well? Because I'm using an earpiece.
Very well, sir. I can hear you,
Very well.
sir. But
Wonderful.
I cannot hear you.
Okay, Jibril, please try to sort out the speaker issues. You can join. You can take up another one as you after sorting out the speaker problem. Nasir Hassan Musa says, how does physical therapy influence neuroplasticity in patients with neurological disorders? So patients with neurological disorders is the patient characteristics here, influencing neuroplasticity. So that is the outcome of interest. But you don't have something that is specific about your intervention. because physical therapy is a profession, it's not an intervention. And therefore, if you say physical therapy influencing neuroplasticity, then it's like you are writing a book. You are going to look at task-oriented training, how it's affecting neuroplasticity. You'll be looking at virtual reality. You'll be looking at functional electrical stimulation. You'll be looking at transcranial direct current stimulation. You'll be looking at robotic therapy. There are so many interventions in physical therapy that can influence neuroplasticity. So if you want a searchable question and you have a question that is very broad, that at the end of the day, the search will be complicated. It's going to be very difficult for you to gather anything that will come back and treat the patient. And so you need something a little bit more specific than just asking about the physical therapy generally, because that's just like asking how the profession influences a particular outcome. In the management of patients with Alzheimer's disease, so we are now talking about patients with Alzheimer's disease. This is the patient characteristics. How do we reduce spasticity? Very good. We have an outcome of interest. You want to reduce spasticity in the management of patients with Alzheimer's disease. So now, this is a question that's very general. So what it means, I'll assume that it's someone that is at that level. Remember the steps that we had, pre-service, novice. I'll say it's either pre-service or novice that's saying, I don't have an idea. And therefore, and remember we said next week on Saturday, we are going to have a class on clinical reasoning. We are going to look at cognitive processes, analytical and non-analytical cognitive processes. Analytical is the one that at the pre-service and novice level, you don't know, you don't have the information, you have to search, you have to read, you have to go to class, you have to take a lecture to be able to have the information. While non-analytical process is the one in which you have the experience, you are seeing patients, and you begin to think of the last patient that you saw. So at least you have some level of experience and knowledge. So this is something that means you are at that novice level. So you and it's okay. It's a genuine question. You're trying to find out what can I use to reduce spasticity in Alzheimer's disease. That is fine. But this is also an intervention question. Remember on Saturday, I mentioned it. I said, especially for physiotherapists, I've come to realize we focus on just treating the patient. Someone will just send us, and I'm sorry I'm saying this. I hope you are not going to feel, because I also, I'm a physiotherapist, I'm involved in that. I'm trying to change, but it's still, this is what we need to focus on CPDs. We need to begin to assess our patients. We need to begin to do a very strong evaluation using clinical reasoning. We need to start diagnosing our patients, having physical diagnosis. For other professions that are here with us, having diagnosis that within the scope of practice of every professional. We need to start thinking of what the prognosis of the patient is before we start to think of intervention. And this is evident here because most of the questions that we are having are coming as intervention, intervention, intervention. How do we examine the spinal range? Wonderful. So at least I'm seeing a question on examination. How do we examine the spinal range of motion in patients with low back pain? We have patient characteristics, low back pain. We have outcome of interest, spinal range of motion, examining spinal range of motion, but this also is that kind of question about that pre-service and novice level where I don't know anything. I just want to search and see what's available, what outcome measure I can use. So this is not specific about asking, can I use this particular outcome measure? But it's a genuine question, it's acceptable, it's very okay, but I'm just saying it's a little bit general, but it is all right. We can use it to be able to get information about those outcome measures that are available. Then at some point, you will now select the ones that you think will be more context specific for your own culture, for your own environment. And then you'll say, okay, this one is not too expensive. It's something that we can be able to apply. What can we be able to, can we find out if it's valid and reliable for use in this patient that I have. So that's also a good question. Is wearing high heel shoe predispose a young lady to low back pain? Now, the young lady is the characteristics of the patient here. So this is not about a patient that has gotten a disease or injury. So this is more of a preventable situation. So you want to find, so risk factor. So I think predisposing a young lady to low back pain, this is more about risk factor. So wearing high heel shoe. So in a lady is the patient characteristics, and then the outcome of interest is to see whether high heel shoe is a risk factor. So to low back pain. And the fact that you are looking at something that has not happened, but you are trying to see whether that thing will put the person at risk of having that disease, that gives the indication that this is a question under examination, but even under examination, it's related to a risk factor. This is another very good one. A male hockey player with knee pain. This is not a complex question. We have the patient characteristics. Male hockey player with knee pain. This is just a patient characteristics. And for this question to be completed, it needs to have outcome of interest, and it also needs to indicate what component of patient management we are dealing with. How can pregnant patients with low back pain benefit from back exercises or back care? So how can they benefit? Now, are we asking if back exercises or back care are effective in treating them? If that's the case, then it's an intervention question. How can pregnant patients with low back pain benefit? So now, what is missing here is the outcome of interest. Because what you're asking is, what will be the outcome of interest? So we have the patient characteristics. A pregnant patient with low back pain is a patient characteristics. Back exercises or back care means it's about an intervention. But what will the back exercise or back care relieve in the patient? So that's what's missing. And therefore, you need to add outcome of interest, something that's specific. Now, if you are just searching to find out what sorts of benefits are there to the patient, that's also a valid question. You don't know that, you want to know that, you want to do a search to know what sorts of benefits they can get. So what sorts of outcome of interest should we expect in patients? That's also okay. You can do a search, you can get that information, but it's a general information. It's not something specific that you just pick and apply to patient. When you get that information, you still have to sieve it to say that out of all these benefits, which one will be relevant to my patient, which one do I focus on? But it's a very good question. It's a relevant question too. Is Oxford muscle grading relevant in assessment of brachial plexus injury? So now this is another thing. Relevant is general. It's not specific. What is missing in this question is the outcome of interest. Our patient characteristics is patient with brachial plexus injury. Brachial plexus injury. What indicates that it is an examination question? The fact that we are looking at whether Oxford muscle grading can be used in assessment. This shows it is an examination question. But what are you trying to achieve? What is the outcome of interest? If you had said, is Oxford muscle grading, can it be used to assess muscle power? We'll say assessment of muscle power or muscle strength is the outcome of interest. But as it is right now, you use a word that makes the outcome of interest not to be indicated in that question. And therefore, that is missing. But, you know, this question is something that you can be able to, even narrative review can help you to see if there is any relevance, just like the other one that said if it's beneficial. So these words indicate that you need a textbook or you need a narrative review to be able to understand the concepts, to know what things are available. Then from what's available, you say, well, they said it can improve, they reduce their pain, it can improve their spinal mobility, it can do this, it can do that. Okay, out of all this, let me see which one my patient is presenting with. My patient is presenting with low back pain. Well, I think this back exercise should then be targeted towards relieving pain. My patient has a reduction in spinal mobility from what I've read in the narrative review. And therefore, well, let me now see if my patient has that. Well, my patient has that. Therefore, let me apply these back exercises to improve the spinal mobility. So all these are relevant questions, only that some of them are not specific. So I think we have taken a number of them. It's already time. We have up to 8:30. The good thing is that we have questions on examination. We have questions on intervention. Before we go to the next thing, coming up with such strategy, I want us to quickly get questions on diagnosis or prognosis. So let's add two. I will leave out evaluation and outcome. They are two of the most difficult parts of the components of patient management, and we can deal with that at a later time. But I believe prognosis is simple, diagnosis is simple. I've already explained. You have done your assessment, and you want to know whether from the assessments you've had, what the diagnosis of that patient is. That is diagnosis. Prognosis, you are looking at three things. In a patient that has this particular factors, say severity of a particular recovery. Say, how long will it take them to be able to sit? How long will it take them to have relief in pain? How long will it take them to be able to have increase in muscle power, and so on and so forth? So can we please quickly give these two? Okay, so we can't hear you. Yes, a call just came in. I had to disconnect it. I hope you can hear me now. So please, can we get at least two questions? At least questions from these two components of patient management. You did wonderfully well, because I can see questions that are very relevant, that cover most of the parts of a question that we are expecting. But I think we need to go further and have questions on other components of patient management apart from intervention and examination. So what are the long-term comorbidities after lung cancer surgery in combination with chemotherapy? So after cancer surgery in combination with chemotherapy. So this question, now let's see what the patient characteristics is after lung cancer surgery in combination with chemotherapy. There is no patient characteristics. The only thing that I can delineate from this is that this is a patient that has had lung cancer. Well, I think that makes sense. So lung cancer surgery, it means the patient had lung cancer. Chemotherapy is about the lung cancer. So we have patient characteristics. Now, what is our outcome of interest? We don't know, because you are saying, what are the long-term comorbidities? This is something that a textbook will explain and at least give the concept. Give the concepts. We can also look for, let me not also limit it to those ones that they are general, to say that it has to be in textbooks or narrative reviews, but we can get them in research papers also, other research papers, only that you hardly have one research paper coming up with so many where you'll say, okay, these are the list, because this is what I see in the questions. What are the long-term comorbidities? So this is a paper that's going to begin to list them. This is this. So you hardly have one paper that will list all of them if it is not a textbook or a narrative review. So unless if you want to now do a review yourself, get all the papers and be bringing out what each paper says a long-term comorbidity is, and you continue to now list them. And that's okay. That's also a valid question. That's all right. So we have outcome of interest. We are looking at what the long-term comorbidities are. And I think the person, Hadiz Abdullah BP, is trying to say this is a question on prognosis. But usually questions on prognosis are looking at time. So how long it takes to achieve a recovery, considering some factors. So let's say if you are saying the factor here is having the surgery. So maybe you are saying if there is a surgery, how long does it take to have those comorbidities? So that can be prognosis, because prognosis can be in a positive direction or a negative direction. You can have the surgery, and then you'll now begin to have those comorbidities that will make the patient get worse, for example. Or it can be that having the lung surgery maybe has helped the patient that has cancer to get better within a particular period. That's also another perspective that we can look at. If I see a question on diagnosis, just one question on diagnosis, we'll move on. So you could have asked a question just like the general ones that you have asked, say, what is the diagnostic criteria for, then you now choose the condition. So we know from diagnostic criteria, we know it's a diagnostic question. Another way is to look at the assessments that you did. Say, okay, for example, we talked about Parkinson's disease. Someone would have asked, will the combination of bradykinesia, rigidity, tremor, gives an indication of having Parkinson's disease as a diagnosis? Remember, I said I'm using these examples as medical diagnosis, because we are going to deal with human movement system, where we are going to see the diagnosis for physiotherapists. Other professions are going to have their own workshops to look at what type of diagnosis will you make in your own profession. But I'm just giving this example, medical example, just so that we can understand the concept, because this is what we are familiar with, not really the physical diagnosis. I have another one that says, in adults with chronic low back pain, how does MRI compare to X-ray in detecting structural abnormalities associated with pain? Now, structural abnormalities, will you say that is a diagnosis? If that is a diagnosis, then that's fine. That's okay. But I doubt if just doing an MRI and comparing it with an X-ray will give you a diagnosis. I doubt if there is any condition that the patient comes and you just do the MRI and you do the X-ray, and it becomes a diagnostic criteria for saying that that condition is there. So this possibly would be an examination question. Now, why do I say that? Let me explain how the difference between an examination question and a diagnostic question will come. If you are trying to do a test or an examination to rule in the presence of a symptom or a sign, this is an examination. But after you have done the examination, the tests, and you have a few, and you are asking, will having these symptoms and signs indicate the presence of a diagnosis? Then this is a diagnostic question. So any question where you are asking about doing a test, observations, radiological investigations, laboratory tests individually, that you do that test or you do that observation and it tells you that there is a symptom or there is a sign, this is an examination question. Well, after you have done the test, you have gotten the results. Now you are saying, from these tests and observations that I've done, can I pick 3 results and use it to say that there is this condition, this diagnosis present? That is when it now becomes a diagnostic question. So at least I know we have approached. Thank you so much to all of you. I can see a number of questions, and this is really very encouraging. Before we get to the next step, let me just ask if there are any questions with regards to what we have just done. And also let me know if you think what we have done is useful. Has it cleared your confusions about these issues of questions, or is it still the same thing? Because it's important for us to be able to get somewhere rather than continue to dwell where we have been when it comes to knowledge and skills. Thank you. Any questions? Okay, I can't see any hands. I can't hear any voices or any posts. So I'll just assume there are no questions. But the comments, at least comments, would have given me an indication of if we are moving in the right direction or if we need to adjust and do something that will help with assimilation more. Okay, we're good to go. That's wonderful. So I think the next stage is, can we pick the questions that we have? Just pick one question. And let's try as much as possible to have diversity. Let all of us not pick on intervention, or all of us pick on examination. Let's at least try to diversify. Pick the questions. Get at least 3 keywords from the question. Then for each keyword, think if there is any synonym for that keyword. So what you do is to copy the question, paste, and then below the question in one posting, you will now do the search strategy. And that search strategy, first part of it is to have the keywords. And if we have the keywords, then each keyword, if there is a synonym that you can think of that researchers or clinicians will use, attach it by using O. So you'll use this word or this word. Then you now go down, and the second keyword, you say this word or this word. Then the third one, so I want at least 3 keywords. Each should have a synonym, if possible. If one doesn't have it, it's all right. Can we quickly do that? So we need to hurry. I can see it's almost 9, and we have not even finished issue of search strategy.
No, why audible, sir?
Okay, I've not seen any posts. Can we move faster? Okay, good. I've seen one. It says, okay, the question again. I said the question that we have posted many questions. I want you to look at that question and bring out at least 3 keywords. 3 keywords. So each keyword, if it has a synonym, you post the synonym. You post the word and its synonym. So 3 keywords, each word, if it has a synonym, post that word and the synonym from the questions that we have above. You can look at the ones that I've just posted. I think they have something that's coming out exactly the way we want it. What I don't know is whether there are synonyms that can come from that question. That's what I'm going to look at now. Is it necessary for patients to undergo nerve conduction study if GBS is already diagnosed to rule out complete nerve damage or complete nerve damage? Okay, I'm not going to go back and begin to dissect the words for whether they have the 3 parts of the question, or whether the question is in what component of patient management, or the relevance of the question. We have passed that. What I'm going to focus on right now is just to see whether relevant keywords have been extracted, just to see if we can be able to get a search strategy with that. So nerve conduction study, GBS, nerve damage. Well, I can accept this because looking at the question, is it necessary for patients to undergo nerve conduction studies? Nerve conduction study is a keyword in that question. If GBS is already diagnosed, so GBS is important to rule out complete nerve damage. Nerve damage is important. Now the question is, Do researchers or clinicians use any other terminology to mean nerve conduction study? Ask yourself that question. Because if some studies use something else and you use nerve conduction study, that study will not be revealed to you when you do the search. GBS, I believe you mean Guillain-Barré syndrome. Is there any other name for Guillain-Barré syndrome? Will clinicians or researchers use that? So maybe what you can do quickly, you can go to Google and say synonym for nerve conduction study, synonym for GBS, synonym for nerve damage. Just see if something will come up. When we go to PubMed, there's something they call mesh. All studies, when they have keywords, that mesh will take the keywords and will send them there and categorize them so that when you go to mesh and you put in your keyword, it will now reveal other synonyms that are used in other studies. So I'm not going to go into that now. Just try to see if you can get any synonym, but the keywords that you have are good. How do we examine the spinal range of motion in patients with low back pain? So you have examination or assessment, good. Spinal range of motion or movement, good. Low back pain or lumbago, good. So that's a good one. You already have a complete search strategy. So that's okay. Keywords, synonyms, examine, assess, spinal range of motion, spinal movement. Yes, that's what was missing because you said movement, while in the other one you said spinal range of motion. I think maybe spinal, adding spinal there will be important, but I think you have taken care of that. Yes, spinal range of motion or movement or spinal movement. Yes, so that should be taken care of. So nerve damage or neuropathy. Aha, that's good. That's good. At least you have gotten something. Possibly there will be an alternative for use. GBS or acute inflammatory neuropathy. So if a study uses acute inflammatory neuropathy, it will come. If they use GBS, it will come. Using O in that search strategy will guarantee that whichever word the article uses will still come up. So this is very good. This is another one, research question. In adults with chronic low back pain, how does spinal manipulation compare to mobilization in reducing pain and improving function? Keyword: chronic low back pain, spinal manipulation, mobilization, and pain reduction / functional movement. So chronic low back pain or persistent low back pain or CLBP, and spinal manipulation or manual therapy or chiropractic manipulation, and mobilization or joint mobilization or passive mobilization, and pain reduction or functional improvement or quality of life or disability or pain intensity. So you have, well, because you are looking at two outcomes of interest. And if you use O, any of them that is in that paper will come. So I think this is clever, and I wouldn't say it's wrong, even though it looks complicated to me, but I think it makes sense because any of them that comes, you are interested in it. And I think that's a good one. Now, how does physical therapy influences neuroplasticity in patients with neurological disorders? It's a physical therapy or physiotherapy and influence or impact and neuroplasticity or neuro regeneration. Well, if studies use influence or impact, that's fine. But if they don't, it's going to affect your search. But if you think studies will use influence or impact, then that's okay. But if studies don't use those words and you use and to connect it with neuroplasticity and the other words, then you are going to have a problem. Leaving it might even be better, but just search and see what articles use. Is it influence or is there any other word that they use when they link physical therapy and neuroplasticity? So this is wonderful, very wonderful, very happy with this. So let me show you how to do search on PubMed. Now you have your search strategy. You can pick this and send it into. But remember, for those that are using O and, if you are using O, you have to either put it in bracket before and, or you put it in quotation mark or quotation mark, sorry, quote, or you put it in bracket. There are some databases that will accept one or the other, or accept both. So we have to experiment to see which ones accept what and which ones don't accept what. So what I mean is, for example, let me just pick this and repost so that we can all see what I mean. So you see physical therapy. So I'll put a bracket there. Oh, sorry, how do I, okay, sorry. Good, physical therapy or physiotherapy, I'll put that in bracket. Then and will be outside the bracket. Then I'll say influence or impact, that also will be in bracket, and will be outside the bracket. Then I'll say neuroplasticity or neuroregeneration. So just look at what I've just released. You'll see those synonyms with O in between them are in a bracket. Then and is between brackets. Influence or impact also is inside the bracket and is outside the bracket. Then neuroplasticity or neurogeneration. So that will help the search engine to be able to bring out something more meaningful. If not, everything will just be cluttered and the search engine will not be able to help out. Please, is there no PowerPoint display, or is it from my end? No, it's not from your end. Last week, the whole class on Saturday was on PowerPoint. We said today we are going to do hands-on practical, unless there is need to review. That's why I kept asking questions. If you had asked me a question that I needed to explain to you, I will now refer to my slides. But what we are doing today is a hands-on activity, and we are using the chat forum for people to post their responses so that they will get feedback on what we are doing. Forum. We are using the chat forum. That's where everyone is posting. And that's what I've been focusing on, to see what you do so that I can provide feedback. I hope I've not lost many of you. All the things that I've been reading out and explaining, they are from the meeting chat. Oh, I'm lost. Oh my goodness.
No, we are with you, Prof. We are with you on the chat forum.
Okay, wonderful. We are with you. Okay, we are following. Wonderful. So Omole Adesewa, please go to the chat forum. And since you just posted on the chat forum, I believe you are now on the chat forum. Okay, we are following. Wonderful. Okay. I would have felt restless. Say all this while that I was alone with only few people. Okay, that's wonderful. That's okay. So now I'm going to share my screen and I will show you. Remember when we looked at databases on Saturday, I showed you many depending on the research design, that hierarchy of evidence. We said that highest at the topmost level is clinical practice guidelines. Remember, I showed you the link to the clearinghouse, National Clearinghouse. And that's the link where you go to get clinical practice guidelines. I also showed you Cochrane Library with a link to that. If you don't have the slides, I will send the slides this night so that you can be able to get those links. So we also had Cochrane. We said meta-analysis and systematic reviews. You can get them there. And then I showed you clinical trials. I said that one is only specific for randomized controlled trials. And then I gave a series of links for all other types of research designs. So PubMed was there. I said it's a research engine. It searches Medline. Medline is the database. And I gave you an example to show what a database and search engine are. I said if you go to a library, there is a librarian. The library has shelves. There are books. The library itself with the books is a database, but the librarian, you have trouble going to locate where the book you are looking for is, and you go to the librarian and say, this is the name of the book. He picks the name of the book. He now goes onto a particular shelf and he searches for the book. He brings it out and he gives it to you. He is the search engine. So Google Scholar, they are all search engines. They go into databases, shelves, and they look for what you are looking for. If you don't give them the right information, they will not be able to bring to you the book or the journal that you are looking for. And therefore, what we just did, that's that search strategy, is the information that you give to the search engine. In this case, the search engine is the librarian. And then the search engine will go into the database, which is now the library or the shelves, to now go and search for the information you're looking for and then bring it to you. So search engine, just like the librarian. CINAHL is another example. We said it's for nursing and other allied health sciences. We also showed you for physiotherapists. Possibly we have other professions here. Apologies. For physiotherapists, we have Hooked on Evidence, which we said is APTA members only that can access it. Then I also gave an example of Pedro. The links are there. And I said Google Scholar is better than Google because it has scholarly articles. But the problem with it is that the way the other databases will screen the articles they house in them, Google Scholar does not do that. And therefore, Google Scholar can give you mushroom articles and journals that have been published without peer review. It's possible to have such, but it's better than Google because it gives scholarly articles, such as conference proceedings, such as textbooks, but Google will give you everything. If I just wake up today and I develop a website, I put whatever rubbish I want to put on there, Google will get that information and send to you. And therefore, it is not good to use that to treat your patients. Not acceptable. We are following the lecture attention from Sokoto. Wonderful. Sokoto, I greet you. So this is just an introduction to this part. I'm going to take PubMed and I will show you how to do a search using PubMed. And the reason why I'm going to take PubMed is because it has a stepwise process of doing a search, which will further help us to understand more of how to do the search, because you can either just pick the information completely, dump it onto PubMed, or if you wish, you can separate it and do it stepwise. So let me just show you how to do both. I'm going to just pick an example that was given by one, maybe the last one that I put in bracket. Let me see if it's there. So please bear with me. If I have little time and a lot of things to talk about, I speak very fast. If I do that, just give me a little feedback so that I slow down. It's better I exhaust something little that you understand than cover a lot that you don't get at all. So please feel free to give me feedback as I move forward. So I'm going to share my screen now. Okay, I hope you can see the PubMed page. For those that are not sure how I got here, maybe let me just open another browser and show you. So if you just say PubMed, because I've used the PubMed before, you will see the option showing .ncbi.nim.nih.gov. So let me just assume that I'm just doing it for the first time. I'll just say PubMed. So if I say PubMed, you just go and click PubMed, and it's going to come to this page. That's exactly where I was when I shared. So let me just close this. So if you pick all what I highlighted earlier. Remember, someone said physical therapy or physiotherapy and influence or impact and neuroplasticity or neuroregeneration. So this is the simple search on PubMed. If you observe here, it says advanced, and I'm going to show you the advanced also, but in the simple one, just put in this search strategy as it is here, and you click search. So click search. Now, this is what is going to come out. I hope you can see that. Just let me know if I shared the right browser. Can you see what I'm sharing? Okay, this yes, I believe is saying yes, you can see. Okay, yes, you can see that. Okay. Okay, wonderful. Thank you. Thank you. So you can see 748 results. 748. That's a lot because you are using general terms. Whenever you say physical therapy or physiotherapy, there are so many studies that have been done on physical therapy or physiotherapy. So if someone, Dr. Jibril, please
Yes,
help us get interventions, just one or two interventions that influence neuroplasticity. Just keep it until we finish this explanation. Then you will now give us that. Another thing is that what word should we use when we talk about influence or impact? If there's anything you can think of, just so that we can narrow down and get something more specific, because that will help people to see reduction in the number of results. We have 748 because you are using general words. Physical therapy or physiotherapy, they are general words. Influence or impact, they are general words. So please just help us get something more specific.
Okay.
So now, and Jibril Samani is an expert in this area of neuroplasticity. He's very good in that area. I believe at some point he'll give us a training on issues of neuroplasticity, interventions that can be used to influence neuroplasticity. So now, we have 748. If you look at this platform, you are going to see a lot of things. You can click save to save the whole information that has been provided, all the 748. You can click email to send it to your email. If you don't want to study them now, you want to just send them to your email until you get the chance to sit down and digest them, you can do that. You can send it to a friend. Just click send to, it will go to your friend. You can sort by different most recent. So meaning number one will be the most recent. This one is saying what year? What year is this? 2020. This one is 2019. This one is 2021. Can you see that they are not arranged by according to most recent? If you go here and you change to most recent, it's going to give you 2024 or 2025 before it gives you the next. Then publication date. Then first author. So it will arrange it as according to the first author's letter. So the first letter, this is R. If you sort it out by first author, is now going to be according to A and so on. Then you can arrange it according to the journal also. So it will give you all the journals that are in A first, and then, so all these are options. Then the way it's displayed also can change. Then if you look at this side, you'll see publication date. If you wish to only have articles that were done in the last 1 year or in the last 5 years, so let's say 5 years. Can you see it now becomes 362? If I say 1 year, so in the last 1 year, studies in this area were only 125. So let's go back to the earlier one that we had, which is 748. Now, if you come here, you will now read the title. So the title will determine whether it's relevant or it's not relevant. Effectiveness of physiotherapy interventions. See, this is what this person is looking for. generally on physiotherapy, not something specific. And that's why I told you, it's a valid question. You don't have knowledge in the area, you want to just get everything. You are not looking for something specific. So this is okay. Effectiveness of physiotherapy interventions in brain plasticity. So can you see, because you have a search strategy, it is giving you something that is relevant that you are looking for. Physical therapy or physiotherapy. If you had used only physical therapy, we start saying, oh, physiotherapy, this article will not come out because this one is looking at physiotherapy and you said physical therapy initially. So can you see physiotherapy is out? In brain plasticity, you have talked about neuroplasticity. It has picked the plasticity. So in brain plasticity, balance and functional ability in stroke survivors. So that is one thing that is missing here. In this question, instead of influence or impact, you would have used the characteristics of the patient characteristics. You would have said in stroke or in neurological patients. So, but because you left it open, it will give you stroke. I believe as we go down, now can you see depression? Depression is coming out. If your particular case is a stroke patient, you go and get conditions that are not stroke, like look at mental health disorders. So that is why we said patient characteristics is important. It's missing in this question, in this search strategy, and that is why you are having all sorts of information coming about all sorts of patients. So I just hope this will help in understanding how to narrow down your search strategy so that you can have something much more specific. Okay, someone said yes, but tiny. I don't understand. I'm not sure what that means. I asked many questions earlier, but that's okay. So now, this is relevant. I will click that. So one item selected out of 748. Physical activity and depression towards understanding the antidepressant mechanism. This is not relevant. It's not looking at neuroplasticity, the role of exercise in management of mental health disorders, and integrative review. This is not what we are looking for. The impact of aerobic and resistance training intensity on markers of neuroplasticity in health and disease. I think this looks relevant. So I'm going to highlight that. Okay, zoom out your screen. It will enlarge. Okay, you want it to get enlarged, right? Oh, it's tiny. You mean, okay, so let me do this. I hope this is better. I think it will show as tiny for those that are using their phones. So, but let me zoom it up. So I've selected at least 2 now. Effect of aerobic physical exercise on neuroplasticity after stroke. This is a systematic review. It's relevant. The effect of exercise and activity-based physical therapy on bone. Can you see this in bone? It's not interesting. This is not what we are looking for. Running from stress, neurobiological. So let me just leave this. And out of them, these 3, you can save the 3. When you save, only the 3 will be saved. You can send the 3 to your email. You can send them to someone. But now that we are in a hurry, we just want to look at one. Let's just open one. So this is the abstract. This is the background. This is the objective. This is the methods. This is the results. This is the conclusion. Neuro restoration protocol that combined several established physiotherapy interventions was effective in improving balance and functional ability of stroke patients in only a 7 days period. So the method, a randomized control trial. So this is an RCT, was conducted with 64 stroke patients from 3 hospitals in Indonesia. Control groups, 32, received conventional physiotherapy, and intervention groups received neuro restoration protocol, which both lasted for 7 days. Efficacy of the interventions were measured on brain-derived neurotropic factor, serum analysis, back balance scale, and Barthel index, respectively. So this is what they did. So let's now see if we can get a full text of this article so that we'll go to the full text and see how they delivered these interventions. Since we are looking at physiotherapy interventions that improve brain plasticity, in your patient, you want to improve brain plasticity. Initially, you didn't know any intervention that you are going to use to improve brain plasticity. Now you have seen some. Let's see how they are applied so that we can now take it and apply it on our patient. So if you look at this side, you'll see options for full text. iOS Press full text. Let's click that to see if we'll be lucky to have the full text. Just hope that we can have the full text. So usually you have to pay to get the full text. From the look of this, I think we need to pay to get the full text.
This one, it has to be paid.
It has to be paid to get the full text. So that's one of the limitations that you are going to have in evidence-based practice. And that is why when you do studies to see what are the challenges of using evidence-based practice, people will say the cost, because it's not all articles that will be free. And to pay for this, if you search, you'll see that it comes at a high cost. It says add to cart.
Euro 27.5 euro.
Okay, it's there, 27.5 euro, exactly. 27.5 euro. Can you see that? Yes, but if you have people that are studying in some countries that have access to full text, I'm not going to discuss the integrity and all that. It's not good sometimes to ask them to send, but if it is for educational purposes like this, usually they help us so that we can be able to explain concepts to participants. But at least we understand how to search, we understand how to get the article, we understand how to know if it is relevant. We understand how to find out if from the conclusion it shows that it is effective. The next step is to get the full text so that we'll read the methodology and see how they applied the method of using that intervention in their patients is the same thing that we'll learn and we'll go and apply to our own patient. I keep explaining this. I just pray and hope you are getting the explanations that I'm making. It's free on SCI Hub. Can someone get it and send it to us? That would be great if you can do that. If it is free, do it and send it onto the platform so that I can download it and show us how we can go to the methodology section and look at it. Another interesting thing with this is about an intervention. And if you go to the method section, the first thing you see there, it says a randomized controlled trial. What this is telling you is that this is acceptable as evidence-based practice, because in the hierarchy, RCT is considered as high quality research. On Saturday, when we were looking at the papers, we got an article that was very relevant, very interesting. But the moment we went to the methods, we realized that it was a case series or a case study. And we said, no. We can't generalize this to our patient. And therefore, I'm not going to even read the methodology to see how they apply it for the purpose of giving it to my patient. Someone asked a question, does it mean then it's useless? I said, no. You can go and read it and study it for the purpose of understanding the area. And possibly if you want to build upon it to now go and do a randomized control trial. It is going to serve just like a pilot study, but it is not something that you are going to pick up and go back to your patient and you apply it. So I think this is understandable, I believe. Now we are going to go back and I'm going to show you how to do the advanced search. And I'm going to do that very quickly because I don't think we have time. I would want you to also try to do this on your own. And we are already at 9:14. So let's see. Oh, we have already filtered 1 year. So possibly we need to go back and remove that. Okay, let's just go to the advanced. Now, do you remember those keywords we had earlier? I think it was physiotherapy, therapy. Okay, let's just say physiotherapy. Just say physiotherapy. You say add. So query box, you have physiotherapy. you search. Now, can you see 15,429? Only physiotherapy. So let's go back. Now, if you come down under history and search details, you'll see the history of all the searches that we did. Initially, remember we did this. It was open 748. Then we now narrowed it to 5 years. We got 362. We narrowed it to 1 year. It gave us 125. Now, we choose only physiotherapy. Let's now choose physical therapy. Physical therapy. Physical therapy. When you add, it will come into the query box. You will then search. It's going to give you 27,129. You know, because of US, they do a lot of research in physiotherapy. You mentioned physical therapy, you have more searches. Let's go back to advanced. Let's see what we have. Can you see #4, #5? #4 is physiotherapy, 15,000. #5 is physical therapy, 27,000. Now, let's do something interesting. Let's say physiotherapy, or no, simply, let's just say #4. O. I think we were using O for physiotherapy and physical therapy. So O #5. So let's see what this is going to do. We add, we search. So we're going to go get more because it's O. You are saying either this, so any paper that has physiotherapy, you need it. Any paper that has physical therapy, you need it. And that is why you have more results. If you go down here, you'll see physiotherapy has 15,000. Physical therapy has 27,000. But if you combine this and this, why combining this and this will have more than this is because there are some that are repeated here and here possibly. But all of them put together, you'll have a higher number, which is 32. Now, we had impact and influence. Influence. But instead of, we'll say influence or impact. You add, you search. You are going to see very big number, 470. Because papers will use influence or impact, there will be plenty, many of them. So that's that. Then the last one that we had was neuroplasticity or I think it was regeneration. Regeneration. If I wish, I would have done neuroplasticity separate and then neuroregeneration separate. Then I will come and say hash the number or hash the number. So I believe you understand that. So to save time, I will just do this. So neuroplasticity or neurodegeneration is giving us 5,442. So let's go back. Now, if you look at what we have here, 405 is physiotherapy or physical therapy. This one is influence or impact. This one is neuroplasticity or neuroregeneration. But remember the initial search strategy, which is number 1 here, is looking at each of these components added with AND. So let's do that. Which is the first one? The first one is physical therapy or physiotherapy, which is now #6. So we'll now have #6. Then we'll now say, and what is the next one? Influence or impact is #7. We'll now say #7. Then we'll say, and. Then what is the last one? Neuroplasticity or neuroregeneration. which is #8, neuroplasticity or neuroregeneration. #8. So let's now add and let's do search. So 125. 125 because it's looking at 1 year. So let's go back and see whether it will give us the same thing that we had when we did the whole search at the same time. #1, no, not #1, #3, physiotherapy or physiotherapy, physical therapy or physiotherapy, and influence or impact, and neuroplasticity or neuroregeneration. But this is filter 1 year. It gave us 125. But when we did them stepwise, at the end of the day, we had the same number, 125. Can you see 125 and 125? In this one, we did everything in one search. Only that we have physical therapy or physiotherapy in bracket. We have and influence or impact in bracket, and neuroplasticity or neuroregeneration in bracket. At the end of the day, it gave us 125. But when we did it stepwise, we were able to come to the same number, 125. But why do I usually break it down into stepwise? Because remember when we were reading one of the papers, we realized that instead of using influence or impact, we could have used stroke. Because if we use stroke, that will limit it to one condition. And if our patient has stroke, all the papers that we're going to have will be relevant to that particular patient that we are planning to treat. And therefore, in that case, instead of changing the whole search strategy, we'll just come and see stroke. I'll do search. I'll do this. Stroke is giving us 31,335 papers published for stroke. Now, if we go back, we'll now see characteristics of the patient is stroke. And stroke here is #10. Please, if you are not following, let me know so that I will not just be going on and I will lose you. I think I did that last week and I thought I should have done things differently. Please, are you following or have I lost you?
We are following, sir.
Wonderful, wonderful. Okay, that's great. That's great. That's great. Good. That's
we are following, Prof.
Oh, that's wonderful. Thank you so much. So now we have stroke, which is our patient characteristic, which we said was missing in the first search strategy. We now want to correct it. Because of the fact that we are doing it stepwise, we are able now to make corrections and we move on. So we say 10, #10, which is stroke. If you come down to #10, you'll see is stroke. And therefore, we put #10 there, which is stroke. If we wish, we can just put stroke. These are alternatives. So what are we dropping? Influence or impact? We don't need that. But we need physical therapy or physiotherapy. So why is it that we have physical therapy or physiotherapy, or physical therapy or physiotherapy is #6, which is having #4 and #5. It gives #6. So we'll just put #6 there. #6. Then we'll say and. What is the next thing that we are looking for? Neuroplasticity and neuroregeneration. What that means is that in patients that have stroke, will physical therapy or physiotherapy be effective in improving neuroplasticity? So that is a better question, or maybe not better. That is a more specific question because it is dealing with one condition, which is only stroke. So we now have, which is the last one? Which one is the last one? Neuroplasticity, which is #8. So we now have hash 8. So we'll do add, and then we'll do search. And this is giving us only 50. Can you see what I said earlier? When we left it open to all conditions, we had 700 and something. But now we narrowed it down to only stroke. It's giving us only 50. Because we now have a search strategy that is purposeful, that has those 3 parts of a question, and that are relevant to one patient or one condition, we're having something manageable. If you work in the clinic, when do you have time? When you see a patient, to go back and sit down and look at 700 or 1 million articles, just so that you can get one that you are going to read and apply to your patient. But sincerely, if I'm dealing with 50, it's a manageable number. And even the 50, I don't have to read through the all 50. Let's see. Neurostimulation for treatment of post-stroke impairments. This is relevant. ALSU angled or whatever, portable neuromodulation stimulator therapy. This might be relevant, not sure, but let's take it. Stroke and neuroplasticity, harnessing the brain's adaptive potential for recovery. This is what narrative review. This is a narrative review. And therefore, I'm not going to take it for the purpose of applying it to my patient. What I'm going to do if I take it is just to read it and understand concepts. Let's see if it's truly a narrative review. I know it is, only that it might take me a while to get the full text. Okay, good. So can you see in some, we can be able to get full text directly. Let's see this one. This is the full text. Wonderful. This is a full text. Stroke and neuroplasticity, harnessing the brain's adaptive potential for recovery. Let's go through. Because if it is a paper like the other papers that we have read from the different types of RCT, would have seen if it is RCT, there will be method. In the method, we'll see whether it is an RCT. Or can you see what I was talking about? This is even an editorial. It's an editorial. So am I going to now read an editorial, pick the process, and go and apply to my patient? I'm not going to do that. Because RCT for intervention is the minimum when it comes to high quality research. And therefore, I'm not going to use this one. And as I've told you earlier, I knew it was not high quality, and therefore, I was not interested in it. And therefore, I will not even click it. Stroke rehabilitation, from diagnosis to therapy, this is similar to what we have looked at. And therefore, I'm not after it for my own patient. Aberrant neural oscillations in post-stroke aphasia. This post-stroke aphasia, and therefore, I don't need it. So can you see how almost 3 to 4 have been screened out so that it further reduces the number that I'm going to deal with reading to see if I have to go back and apply to my patient. Therapeutic importance of exercise in neuroplasticity in adults with neurological pathology. The problem with this is that it's general. When we open it, we might see stroke, it's also there. But because it's not stroke, I'm going to leave it. Interpretation of data from translational rodent nerve injury and repair models. I'm not going to deal with this also. Influence of high-intensity interval training on neuroplasticity markers in post-stroke patients. This is important. So you'll continue like that. Dementia after ischemic stroke, I will not take that. Electroacupuncture following cerebral ischemia in rats. This in rats. And therefore, I can just have an understanding of the area, but I can't take the intervention given to rats and go and apply to my patient. Therefore, I'm not going to include this. Influence of high-intensity interval training on neuroplasticity markers in post-stroke patients is systematic. I've already picked this. So let's go back and see how many we selected. 3 items selected out of 50. I don't think on this page there are 50 because it's page 1 of 5. But at least I know we have up to 10. And out of the 10, we only have 3. So if we have 3 for every 10, we're only going to have 3 times 5, which is 15. And that is much more manageable. So the next thing is to now open that article. So let me open this first one. It's possible from the abstract, it may not even be a relevant one that will apply. So neurostimulation, the use of electrical stimulation to modulate the activity of the nervous system is now commonly used. So can you see this is a narrative review? Aha, wonderful. This review focuses on neurostimulation techniques that are now in clinical use or that have reached the stage. I will read this to understand the concept, but I'm not going to take anything and go and apply to my patient. Why? Because this is a narrative review, and a narrative review is down in the hierarchy. It's only what's below it are expert opinion and textbook. After these two is narrative review, and therefore it is low quality research. I'm not going to even bother going through the article. And therefore this one is off out of the 3. Portable neuromodulation stimulator therapy. Let's open this and see. This also is a review. This is a review. Although reasonably safe, high cost and prescription requirements will limit. Why do I say it's a review? Because I don't see any categorization looking at introduction, methodology, results, conclusion. I know this is a review, even though I've not gone to see the full text. So I can read that, understand the concept, so that I will know more about neuroplasticity and physiotherapy management of patients with stroke on how to improve their neuroplasticity. But I'm not going to take that and apply it to my patient with stroke to treat them. Now let's see the last one. This is a systematic review. And remember, at the topmost level of the hierarchy, after clinical practice guideline, you now come down to sorry?
Meta-analysis.
Meta-analysis. The next is systematic review. And therefore, this is something that I would want to apply on my patient. But let's see what the background is. We'll see the objective, and then we'll now see the conclusion. That will determine whether we even need to go into the methodology and the results to see what we can extract to apply on our patient. Exercise has shown beneficial effects on neuroplasticity. Therefore, we want to analyze the influence of high-intensity interval training. This is the intervention, high-intensity interval training. Remember, the question says physiotherapy or physical therapy. We didn't know what intervention, but at least with this evidence-based activity, we have come to realize that if I have a patient that has stroke and I want to improve their neuroplasticity, I can use high-intensity interval training on neuroplasticity markers in post-stroke patients. Now let's go to the conclusion. Because if the conclusion says it wasn't effective, there is no point taking it and applying it on my patient. We conclude that HIIT improves post-stroke recovery by increasing neuroplasticity markers. However, a limited number of studies have been found, indicating that future studies are needed that assess this effect and include the analysis of the number of intervals and their duration in order to maximize the effect. Before those studies are done, at least I know I have something that I can use for my patient. So let's now go to the methodology. So if we have a full text, and I pray we have.
That will be.
Yes, it's available, PDF. I hope you saw how I got the full text. This is the full text, very important. Now let's go down to the methodology and see what we can extract. So we are beyond now looking at introductions. We are beyond looking at that because we are sure it's what we are looking for, materials and methods. So I'm not going to go also into details of methods, materials, and what have you. We can read all this. In the, Dr. Samani, I think it is you and someone that's going to deal with systematic reviews, right?
Yes.
And meta-analysis. Yes, so all the other details about how to do systematic reviews will be dealt there. My own issue now is just to go and extract information about that HIIT. How is it applied to patients? So I can see here, you see, the inclusion criteria were randomized clinical trials, studies whose participants were 18 years old or older with stroke diagnosed by a physician, which uses HIIT protocol as the main treatment or as a coadjutant treatment. Now, when you have a systematic review, you hardly have the systematic review explaining the procedure. What you can have is a list of the studies that have used that procedure. So if the systematic review does not explain the procedure, then out of those RCTs, randomized controlled trials, that are used, that are synthesized in the systematic review, you will go back to that paper. In its methodology, you are going to see the detail of how the procedure is applied to patients. So let's just go down and see the list of studies and whether the procedure is included in this particular one. In total, 101,766 articles were retrieved. A total of 1,143 results were obtained. So let's just go down and see. This is the study characteristics. This is showing the number that they got and how they narrowed down to the number they used, which is 8. They only used 8 articles. So let's see. Aha, so this is it. So this is for each study. I hope you can be able to see this table. For each study, they are going to give the details. So let's see. Nepview et al. In 2017. This is the number, the population. 22 participants they used. The participants were 6 months after stroke. Now, this is the intervention, and this is exactly what I'm looking for. Motor task for skill retention, time on target, rest, group 1. HIIT, that's what we're looking for. 1 session. Group 2, motor task for skill retention, time on target. So this this is the interventions. HIIT, 2-minute warm-up. So this, remember, it's an exercise, high intensity exercise. This is the dosage. 2-minute warm-up, 25% peak workload GTX. 3 minutes, so there are 3 minutes that they do 3 times. And for this exercise, it's 100% peak workload GTX. With active recovery of 2 minutes, 25% peak workload GTX. This is the dosage of the HIIT that they give. And what measures did they use? GTX, VO2, HR max, Pmax, CSE, SICI, ICF, CSP. They will define these measures. And the outcome, HIIT increases skill retention. If we go back to this paper, Nepview et al., it will give more details, explanations about this. For me, reading this, I can't just go to my patient and apply this. I need more understanding. And this is where the issue of practice-generated knowledge now comes up. It's either I go back to this paper, Nepview et al., which I'm going to try to do before we close. If I get clearer picture of how this exercise will be applied using this dosage explained here, then I will apply it on a subject. After applying it on a subject, then I will have the confidence to take it to my stroke patient and apply it. But if I try to understand it and I can't, I'm not even going to go to the subject. I will find out someone that can train me. If I can't find out anyone that can train me close by, I will go to the corresponding auto information in this paper, Nepview et al. 2017, and I will look at their phone number or email address, and I will send them an email. I saw a very interesting intervention you give to your patients, which is the HIIT, and I want to apply to my patient, but I need training. Then they will guide me on how to get the training. Maybe they have a video, they will send it and say you must pay or it's free. Maybe they will refer me to their website. They may refer me to a textbook. They may refer me to another person close to me that can be able to give me that training. And it's only when I get the training through CPD, then I will go and apply it on a subject. Then I will now go to my patient and apply it. This is what practice-generated knowledge is all about. After finishing learning the skills, when I go to my patient, I will now explain to him. There is one paper, Nepview et al. 2017. In fact, that paper is even part of another bigger paper, a systematic review, that has confirmed that HIIT exercise, high intensity, whatever exercise, is effective in improving your neuroplasticity. This is what neuroplasticity is all about. You know, in your brain, you have an injury. If you want to clear that part that has been blocked by the injury, you need neuroplasticity. To achieve neuroplasticity, this exercise has been shown to be very effective. This is what they did. This is what they showed. This is how to apply this exercise. What do you think? They said, oh, this is very interesting. And from the way you explained the exercise and the video you showed to me, is something that I can do. In fact, it's not just about the neuroplasticity. My ability to now go out and move my body is going to, then the patient has accepted it. And then evidence-based practice is complete. You have gotten the evidence, which is this systematic review, Nepview et al., Krausik et al. 2019, and all other evidences. You have gotten the evidence. Each of these evidence that are used in this paper, they are randomized control trials, and they are all acceptable because RCT is the minimum for interventions. And the systematic review is even higher than them in hierarchy. And therefore, you have completed that part of fulfilling the criteria of having a high quality research. You have done a training on how to apply. You have tested it on a subject. You have tried it on your patient. And then you have continued to use it on other patients. Practice-generated knowledge has been acquired. But you didn't stop there. Any patient you are trying to apply it to, you must sit with the patient and explain the concept to them. You ask them if they think it's interesting. They accept it. They give you consent, and then you apply to them. The third component of evidence-based practice also has been acquired. What then? Then the final thing is to get back and study the process to see where you made an error. Either someone gives you feedback, or you yourself, you say that, look, that systematic review that I used, I remember they said at the end, there are some other studies that should have been done to even make it better. Then you now go and begin to search if after the 3 months that you have been using this article, that study has been done. Then you now exercise, say, oh, look, there's something better now. Let me drop this systematic review. And all these RCTs, let me go back to that new study that has been published that has shown an update in how to apply this thing to patients. This is the way to go. And this is what evidence-based practice is all about. Now, if I had time, I would have gone through all these studies and all those that are in neuro that treat patients with stroke. I will advise you to obtain this article. Maybe if Dr. Jubril Samani can help post it on the group, go through all this. At the end of the day, anyone, okay, let me just open this first one that I was referring to. Search in Spotlight, search in Google. Whichever one, let's see whether it will give us. Oh, this is coming. I think is the way that I'm doing the search. Okay, let's say Spotlight. Well, I'll see how I can get the article later, but it will have been interesting to see what the article has. Okay, it's here. I think it was 23. NevView, yes. So what I'll do is just to copy the title and then go into the browser and paste it. But it should be Scholar, Google Scholar. Yes, scholar.google.com. Then I will paste it. So I'm not afraid of Google Scholar now, because where I got information about the article is an acceptable database. I got it from PubMed. Now is just to search it. The fastest way is Google Scholar. Can you see where it says PDF at the side? I just click PDF and see the full text of the article is there. And this is a very good journal. Wow, neuro rehabilitation and neural repair, they don't give full text. I don't know how we got the full text. It was one of the papers that I used to read when I was doing my PhD, because it's really very, very strong journal at that time. I don't know now, maybe it's even better or less. A single bout of high-intensity interval training improves motor skill retention in individuals with stroke. Conclusion: the performance of a maximal graded exercise test triggers only modest neuroplastic changes in patients with chronic stroke. However, a single bout of high-intensity interval training performed immediately after motor practice improves skill retention, which could potentially accelerate motor recovery in these individuals. So we know it's good because the conclusion says it is. Let's quickly go to the methodology. Methods. Experimental design. Patients attended 3 experimental sessions. On the first session, after an initial physical, I hope you can see that. Let me enlarge. After an initial physical and cognitive evaluation, all patients performed a maximal symptom-limited GXT. Still want to know what this GXT stands for? Oh, sorry. Dr. Somani, do you know what that GXT? I think it should be written somewhere.
You check the introduction.
The introduction, yes, or the keywords. It's not okay. Introduction, maybe, yeah. Yes, I can see HIIT. Remember all those CSE that we are talking about, sustained increase in, okay, CSE. This is corticospinal excitability. ICF is intracortical facilitation. These are all terminologies that are related to neuroplasticity. But that GXT is something, okay. Graded exercise test. Graded exercise test.
It's operational.
Yes, graded exercise test. So can you see it here? That GXT is graded exercise test. So Dr. Badaru is GXT, graded exercise test. Before, all patients performed a maximal symptom-limited GXT, graded exercise test, to assess their VO2 peak. Immediately before and over M1. So this TMS is expert here, transcranial magnetic over M1, to evaluate the acute effects of exercise on the CSE, ICF, SICI, and the CSP in both hemispheres between 2 and 7 days after the first session. Participants reported to the laboratory again. So let's see whether the HIIT is explained. So the exercise group, performed 15 minutes of HIIT, and the control group simply rested for the same period. So because it's the control group, they are not doing anything. 24 hours later, third session, all patients underwent a test of the motor task to assess skill retention. You know what I'm trying to extract here is how is this HIIT given? Let's get the full process. Transcranial magnetic stimulation, initial evaluation. This is the graded exercise test. The maximal voluntary contraction, corticospinal excitability, intracortical facilitation, time on target motor task, high intensity interval training. This is where it is. 10 minutes after motor practice, patients randomized into the exercise group performed HIIT on the same recumbent stepper used for the GXT. Because remember, they did the GXT earlier. See details of a similar HIIT protocol in Roig et al. They are now referring us to another paper. It takes patience to be able to learn and get these procedures before you go back to your patient. And this is also possibly if someone is going to interview me about evidence-based practice. I say the issues of papers not given the protocol directly in their paper, that they have to refer you to another paper. Sometimes you feel it's frustrating, but it's worth it. Because by the time I learn this procedure, my patients will be benefiting from it. HIIT started with 2 minutes of warm-up, 25% peak workload, followed by 3-minute blocks of high intensity, 100% peak workload. Now, I've gotten more information because when I was reading that systematic review, when they talk about that 25% peak workload GXT, I didn't know what the GXT was about. But now, if you go up, you'll see what the GXT is about. Graded exercise test. We used a well-validated GXT protocol. They are also referring you to another paper, 41, that uses a whole body recumbent stepper, ergometer, to assess VO2 peak in patients with stroke. Heart rate and blood pressure were measured continuously with a HR. Electrocardiography monitoring was used in those individuals with cardiac morbidities. So we are not using it. It's only when they have cardiac morbidities. So don't be afraid that it's not something you can do in your clinic. The rate of perceived exertion was monitored with the Borg scale. We have an additional information. And therefore, if we connect it with what we have here, it will make more sense. So HIIT started with 2 minutes of warm-up, which is 25% peak workload GXT. We know how to get the peak workload GXT. All we need to do is to take 25% of it, followed by 3 minutes. So it's a 3 minutes plus 3 times. 3-minute blocks of high intensity. Instead of 25%, which was for warm-up, we'll now use 100% peak workload of the GXT. And we have already seen above how that GXT is calculated. We'll now take 100% of it, interspersed with 2 minutes blocks of low intensity. So you do the 100%, 3 minutes, then you do the 25%, 2 minutes in between. Participants were asked to maintain a stepping cadence of 80 steps per minute. Intensity was monitored with a HR monitor, a rate of perceived exertion with the Borg scale. Believe me, with all these things that I've explained to you, I will still need to study this more, apply it on subject before I go and apply it on my patient. But now that I know there is a paper that has shown that this is effective in improving neuroplasticity of my patient, and I know that improving neuroplasticity of my patient will have an impact on their motor function and their activities of daily living, why wouldn't I use this for my stroke patient? I will use it, but I will learn this more. I will get more training, and then I will go and apply it to the patient after explaining to them how this works and how it is going to improve their condition from impairment, projecting what their disability and handicap will be with the improvement that we are going to get in this. Sorry, I've spoken for a long time, but I'm excited because as I teach, I learn. This is something that I'm going to leave on my system. I'm going to learn it more, and I'll begin to apply it on my patients, unless there's any reason I find through evidence-based practice again in the future that I shouldn't apply it to my patient. I'm very confident that this is something that I'm going to take forward into the clinic. Any questions at this point or any comments, please be active. Let me hear from you so that at least I'll be able to know that we are together. Okay, good. So now, can we do this? This process that we went through, can you practice it? I know it's 11. We are not going to wait until 11 because I know I've dragged you. And this is not something that we should sustain for long. But let's just, if someone wants to tell us a joke, please feel free. We'll take 5 minutes. Just do something that is not serious. And then we'll come back and just take 30 minutes. We're not going to wait until 11. We'll take 30 minutes to practice this. I need information about this PCOS. I think when you say PICO, you mean the 3 parts of a question, but when it is intervention, it becomes 4. PICO, which the patient characteristics, the component of patient management, the outcome of interest, and then the comparison. I don't know whether that's what you are referring to, Yusuf, or is it something that you saw in this paper? Please just make it clear whether the PICO that I know for parts of a question for an intervention, if that's what you are referring to, or if it's something else. We said we wanted to do something not serious. Mr. Abdul Malik is bringing something very serious. If we get all the information needed on a single paper, can we rely on it, or we need to search more? Well, you can rely on it in as much as it's a high quality research. You can rely on it. But then searching will continue. Believe me, the people that I trust the most with my patients, that I refer to them, are people that I know that are always searching and getting additional information and reviewing and updating, so that one day they will say, I use this paper, another day they will say, do you know that I got an update, another paper that is even better than that one? Yes, I got it. So in as much as peer review allows the paper to be published, then it's not harmful to your patient. But as you continue to search, you may get another one that is better than that one, and then you update. The Journal of NNR is only available to members of American Society of Neurorehabilitation. Yes. So see, when you begin to enjoy evidence-based practice, and evidence-based practice begin to bring kuncha to your pocket, that is when you will appreciate the value of paying those dollars and pounds to continue to get those articles. But you need to start from somewhere. Start with the free ones. But by the time you apply to patients, and one patient said, wow, how did you get that technique? I said, I had to pay 27 pounds. No, I need to pay 27 pounds to even get a better one than that one. I say, okay, don't worry, I will add 100% to your charges. You just go and pay, you get it, and you continue to enjoy your practice. In the latter one, after going through this tortuous route, then your patient is telling you stories about payment for your service. Well, let me tell you something. Sincerely, it's because the patient has not felt the impact of what has been applied. The patient has not got the impact of the explanation about the processes and the research and all those things. Try it. Patients want the best. And patients that can pay usually are patients that are educated, that know the value of research and what evidence-based practice is all about. How do you manage your time regarding EBP? It's just a daily thing. How long does it take you to browse on social media? All this Facebook and WhatsApp and what have you. Sometimes if you look at the number of minutes, when I was doing my PhD, I think I told you maybe on Saturday on another forum, I said, when I was doing my PhD, that time I really was not into social media at all. So when I go to the office doing my PhD, what I do, if I get tired, and I, like now, it will be social media. That time it will just be to go to Google Scholar, to go to database of the School of Southampton University, and I'll be extracting. Right now in my system, I have hundreds, if not thousands, of articles. At that time, I'll just open, I'll read. That's how I got to know about evidence-based practice. That when I returned home, I was asked to teach. I brought the concept. I remember some of my students used to call me father of evidence-based practice. I was very young. What did I even know about evidence-based practice? Up till now, what do I know? But at least that interest and the commitment, every day I search. And there was a time that I took it upon myself. Every day I was going to read one paper. It doesn't take much. I will just read the objective. I will read the conclusion. Then I'll just go to the methodology. It doesn't take 10 minutes to do that. And to search, let it even take 1 hour to search. If I use social media for 2 or 3 hours, let me just take 15 minutes every day to search for articles. Save them, read one out of them. Tomorrow, read another one. Continue like that and see the magic that's going to happen in your practice.
And one good thing with that even is nowadays, because of the Google account, if you keep searching an area as a clinician, at a time you will just be receiving alert on any new research done. You will just be seeing all the time. And you just be reading without even searching.
It's true.
Very searching the area. The Google will recognize all the device that this is your area, and it will just be sending you alert of new happenings.
It's true, very true. Just put it into practice and see. As someone is trying to say in higher institutions, I don't know whether you are saying it's not obtainable in clinics. Believe me, evidence-based practice is for the clinician. It's not for the academicians. It's for the clinicians. You are sitting, you are seeing a patient. You just ask a question. We'll do, what is it called? Clinical reasoning. And you'll see some of these things of how a clinician will think about something. Now, I see what medical doctors do that a lot. Before computers, you will see them with their books. They finish seeing a patient, they will open the compendium of medical whatever. They will now be reviewing, what did I do last? Should I have done it better? Now, you see them with their, some of them, with their device. When they finish seeing a patient, 5 minutes in between seeing one patient and another patient, they are trying to get information about how best to manage that case that they just managed last few minutes. The person that will see a patient and say, pay me 100,000 per session. I know that person. He's a physiotherapist. And this is what he does. Every single time he sees a patient, he wants to update. Sorry, I've talked too fast and long, beginning to cough. But yes, this is something really that if you start, you will not stop because you'll see the magic in it. Okay, so I think, could GXT please elaborate? I think it's in the paper. As I've said myself, I'm studying it more. I will not just go and apply it to patients, but I think what we'll do, Jibril Samani.
Yes.
Dr. Jibril, I think what we'll do,
okay,
these papers that we are looking at,
okay,
why don't you begin to pick this kind of interventions that have been shown to be effective? And they are there in RCTs and confirmed in systematic reviews. Pick them. Let our next series of workshops be specifically on this kind of interventions.
okay.
We'll say that 3 hours, the only thing that we are going to do is just to discuss and do practical on only one intervention that we know is important in a particular specialty. It could be this year, additional sessions. It could be next year, that our workshops are not going to be general workshops that will just come and be talking theory. And you'll talk about 20 interventions that none of them is impactful. Let's select one. Let one day, Saturday, the whole workshop is going to be on only that one. So that at the end of the workshop, anyone that goes to clinic can apply that to patients. So please take note of this, you and Hafiz, so that we can begin to see how we can practicalize this.
We have some still this year that are specific.
Okay, so that's fine. Please, Dr. Jibril, can you post this on the WhatsApp group?
Okay.
Or on the chat forum, whichever one that people can be able
the article?
to notice. This particular article that we just read.
Okay.
Yes, we'll share it. Dr. Jibril will share it. So I think let's go into
This was the
from
title.
this.
Let me the title page. I want to see the title.
Okay, the title page. Okay. Can you see it now?
Yes.
Okay. Yes. So please, can we just try? As I've said, we are not going to go beyond 10:30 because I know how intensive it has been. I wouldn't want to really stress you too much, but I just want everyone to try, just like I did, just try to get one article through the process. Go through the abstract. What's the objective? See if the conclusion shows that it's effective. If it is assessment, let's see if it is valid and reliable, and then go through the methodology and see if the process of applying that intervention or that assessment is clear to you, whether you can apply it on your patients. If you can't, how do you think you can get the training to be able to learn how to apply it on your patients? So do that process. I will give between 5 to 10 minutes and then give a report. So I'll just be silent. The moment I see one report, I know we are done. And then when we read the reports, we'll then close. I will take questions and answers or comments, and then we'll close. Thank you.
It's in the WhatsApp group. Please, the article is in the WhatsApp group. you want to go to that. Let me see. Open the tension here. I've also attached it to the WhatsApp, to the chat forum, the full text. You can check for it there.
Okay, I think because we agreed that we are going to close by 10:30, it's just 4 minutes to the time. Possibly people, if anyone is almost done, just let us know so that we can wait for a minute. But if you are far from completing the process, I think we can close now. Then we'll use that platform. This practical platform can continue to operate. I will be on the platform. Dr. Jibril will be there. Post your questions or responses to whatever it is that you have gotten. Let's go. I think we'll continue interacting on this platform for up to a week, one full week. So within this week, any questions that you have on evidence-based practice, any concerns that you have while you are practicing, you are trying to put what you have learned into practice, you can send message on the platform. I will try as much as possible to respond in time, but if not, Dr. Jibril will respond. If there's anything that needs my response, he can reach out to me and we'll keep it active. Unless there are questions or comments, I think we'll be closing. I'll just give 30 seconds just to see if anyone wants to make a comment or a question. Okay, Dr. Jibril, over to you. Thank you so much, everyone. May God bless you all.
Thank you, sir, for the presentation, and we thank everyone for attending, and then hoping to see you in the subsequent sessions. I know it's already getting late, though here it's 5:30 a.m., so it's fresh morning. So good night to all, and thank you for participating.